All right, well, hello everyone. So we're going to begin our discussion on the lymphatic system, right? So before we begin, take a moment to consider what you already know about the lymphatic system, right? So if you've reviewed a little bit of the cardiovascular system, right, you've likely come across, or you have come across some comments, some things about the lymphatic system and the role it plays in fluid balance in the body, right? So picking up some fluid from the interstitial space as it left our capillaries between our arterioles and our venules, right? So you at least know a little bit about it, right? So we're going to talk about the lymphatic system in the context of its different types of vessels, so capillaries and vessels and trunks and ducts. We'll talk a little bit about the fluid itself, and then we'll talk about different types of lymphatic cells. We'll talk about lymphatic tissues and some other related things. Right now, one other thing to note is the lymphatic system also has a relationship with the immune system as well. Right, so we'll do a separate discussion on the immune system, but do know that the lymphatic system and the immune system are they're not the same thing, but they're kind of interrelated, right? And they have some overlap, right? So if we consider the lymphatic system, right, we already mentioned some of these, right? So big thing, transporting fluids, right? So transporting and housing different types of lymphocytes. Recall, lymphocyte is just a type of leukocyte, right? So a type of white blood cell. Returning various types of fluids throughout the body. The fluid that we'll talk about is called lymph. Or lymphatic fluid, right? And then we'll talk about these main components. So we'll talk about lymphatic vessels. We'll talk about lymphoid tissues, right? This should say T, so let me add tissue there. Lymphoid tissues and organs, and then we'll discuss the route that fluid takes as it works its way through the lymphatic system, right? So just an image to kind of outline and show you some of these different things, right? So we've got our lymphatic vessels here. We've got other types of lymphatic structures. We'll talk about what's called primary structures and secondary structures. These are going to vary based on what happens to the cells at those locations. So what happens to lymphocytes in primary lymphatic structures and what happens to lymphocytes in secondary lymphatic structures. But what we'll focus on first are our lymphatic vessels, along with the fluid that's flowing through those vessels, right? So if we look at lymphatic fluid first, right? So lymphatic fluid, you may also just see it called lymph, right? If you see something called lymph, that's lymphatic fluid, right? So how is it formed, right? How do we get lymphatic fluid? Well, we get lymphatic fluid from ultimately from our cardiovascular system, right? So the fluid that's leaving our circulatory system at the level of the capillary. Remember, we have capillary filtration. We've got some fluid leaving, so out due to that positive net filtration pressure on the arterial side of the capillary bed. Some of that fluid leaves. Some of that fluid gets reabsorbed back into the capillary bed on the venous side, and then some of that fluid stays in the interstitial space that becomes interstitial fluid, and then gets picked up by our lymphatic system capillaries, right? So our lymphatic capillaries. So this here is an animation. I'll show you a few more pictures of some lymphatic capillaries in the upcoming slides. But here you've got a lymphatic capillary. And I'm going to note and tell you here in just a second something important about the lymphatic capillaries that distinguish them from our capillaries of our cardiovascular system, right? So the lymph itself, it's mostly, it's very similar to blood in the sense that there's water, there's solutes, there's small proteins, but there's also going to be old kind of maybe dead cells, debris, pathogens, and as we'll see in a little bit, there may be even cancer cells that can enter our lymphatic capillaries, right? So if we look at the capillaries in more detail, the lymphatic capillaries are these overlapping, or the cells making them up are overlapping such that they create a little flap, and this flap is essentially, think of it as like a one-way valve, right? It's a one-way valve that allows the fluid that's going to become lymph, so coming from that interstitial fluid, it's allowing that fluid to enter the lymphatic capillary, but it's preventing the fluid from leaving, the lymphatic capillary, right? And you have these intermixed in and among the blood capillaries, right? So the capillaries of our cardiovascular system, right? Now we don't have these in certain areas, namely bone marrow, red bone marrow, our spleen, and our central nervous system lack lymphatic vasculature, right? They're lacking these lymphatic capillaries, right? So you can see here this image on the right, these overlapping cells. So here you can see a good example of this overlapping arrangement of these endothelial cells, right? So in that case, they're very similar to blood capillaries. They're a little bit larger, and they have a more internal structure that very closely mirrors our veins, right? So remember, and this is really as we get into bigger lymphatic vessels, so lymphatic vessels and trunks, but they have valves as well. So just like our veins and our circulatory system have valves, so too our lymphatic vessels have valves as well, right? And these valves are serving essentially the same purpose as the valves did in our cardiovascular system, right? So again, maintaining kind of one-way flow of fluid, right? Now there are specialized lymphatic capillaries, one called a lacteal, and we'll discuss this more whenever we do cardiovascular system. But a lacteal is a lymphatic capillary in our gastrointestinal tract that's necessary for absorbing lipid-soluble substance, right? And as we'll see, the lacteal will kind of move up in the middle, in the core of our villi, or our microvilli in our digestive system, right? So we'll get to that whenever we get to digestive system and GI, right? So again, here you can see an illustration of our lymphatic capillaries, and note that they are interspersed kind of in between our blood capillaries, but also notice that they're close-ended, right? So remember, our cardiovascular system, it's a closed loop, but it's continuous, right? So you move continuously from large arteries to small arteries to arterioles, into the capillaries, into venules, into small veins, into large veins, back to the heart, right? And it's this one closed loop, right? So it's continuous, right? Our lymphatic capillaries are different in the sense that they have a beginning, they have a true beginning where it's closed-ended, where it's closed off, right? And so you can see here on this right image here, down here, there's this closed-ended, right? It doesn't continue this way. This is the start of that capillary, and then all the fluid is flowing in one direction, right? If we go back up to this image, you see the same thing, right? It's this closed-ended structure, and you can kind of see some of these in this illustration here, and then the fluid is going to enter and flow in a single direction, right? And so this is a key difference between lymphatic capillaries and the capillaries of our circulatory system, right? Our blood capillaries, right? So you can see the blood capillaries here, they're continuous with the arterioles on this side, and they're continuous with the venules on this side. There's no point where they necessarily start like you have with this lymphatic capillary, right? So what's causing the fluid to actually move into these lymphatic capillaries? What's largely the same pressure that's promoting the movement of fluid out of our blood vessels and into the interstitial space, right? So think that hydrostatic pressure, right? Hydrostatic pressure. So remember, hydrostatic pressure was simply the pressure of static fluid, right? So just the pressure that the fluid puts on the fluid around it and on the vessel that it's in, that's forcing fluid out, right? So here you can see this pH, this is hydrostatic pressure, is large in the in the capillary, small in the interstitial space, so fluid is going to move out. Oncotic or osmotic pressure is larger in the blood vessel, so it's going to pull this fluid, some of the fluid back in. So this is filtration, this is absorption, right? On the arterial side, you get net filtration. On the venous side of the capillary bed, you get net reabsorption, right? That same pressure, right? That same interstitial fluid hydrostatic pressure here, so this IFHP, interstitial fluid hydrostatic pressure, is pushing fluid from this interstitial space between the cells and the capillary into our lymphatic vessel, right? Into our lymphatic vessel. And again, if you recall that kind of structure of the lymphatic capillary where it has those one-way valves, right? That fluid is being forced in, again, because of the interstitial fluid hydrostatic pressure, into the capillary, And then again, that valve is acting like a one-way valve such that it's preventing the fluid from moving back out into the interstitium, right? So you have these anchoring filaments that help to anchor and keep these vessels open. And again, you have this pressure that's forcing the fluid in. And then once you're inside the capillary and you move into larger vessels, again, you have those valves that are helping to promote the one-way movement of the fluid, right? So one important thing related to our lymphatic system is the fact that it can not only transport and move the lymphatic fluid, but also potentially dangerous things that enter that fluid, right? So foreign cells, debris, but also potentially cancerous cells as well, right? So the movement of a cancer from a kind of primary site to a more secondary site, so establishing these secondary tumors, this is called metastasis, right? Or you would say the tumor metastasized to a different organ, right? So from the breast to the lung, or from the skin if it's melanoma, and the melanoma metastasized to a different organ, right? Something like that, right? And so you'll see this occurring, and in fact, one way that cancers are kind of rated and described is on the involvement of the cancer spreading to nearby lymph nodes. So again, part of the lymphatic system, we'll talk about lymph nodes in just a little bit. And then the rate of metastasis, right? So has that cancer spread to another part of the body, right? So this graphic here just simply shows how this can occur. So again, you have this primary site of the tumor, this primary cancer site, and again, the cancers appear in normal. The cancer itself is not normal, but it may appear in a normal organ or other body region, and those regions have a blood supply and they have a lymphatic supply as well, right? So the cancer can enter into other routes, right, that can then take the cancer to these secondary sites, right? So these more systemic sites right here. So this illustration is showing a vascular channel, right? So this would be flowing in the circulatory system, so blood, and then you've got these other cancer sites that are using a lymphatic channel as well, right? So one's using blood pathway, one's using lymphatic pathway to the lymph nodes, and then again from these lymph nodes it may spread to more systemic sites, right? So again, the lymphatic system has a big role to play in the metastasis of cancers, right? If we continue and we move just past our capillaries, we ultimately end up in our lymphatic vessels. Think of these vessels as being similar to veins, right? In terms of their the direction of flow, in terms of their overall structure. So they have those tunics, right? Those three vessel tunics, the tunica externa, media, and intima, same as our other vessels. And again, big thing here is they contain valves, right? So these valves are helping to promote the one-way movement of lymphatic fluid. And because they lack significant amounts of smooth muscle, they also rely on different pumps that our veins also relied on to help move blood, right? So recall in our veins, because they lack a lot of smooth muscle, they relied on the skeletal muscle and the respiratory pump, right? So recall skeletal muscle pump was simply the contraction of skeletal muscles pushing on the veins, and in this case pushing on lymphatic vessels and creating a localized area of high pressure and then a more kind of distal area of low pressure and forcing that fluid to move in that direction. The respiratory pump was doing the same thing, but instead of the muscles, it was because of our diaphragm contracting and relaxing, causing increases in intra-abdominal pressure, a decrease in intrathoracic pressure, and the blood was moving from high pressure to low pressure, so from the abdomen back toward the thoracic cavity where we have our heart, right? So again, in this case, it's the same for the lymphatic vessel, right? The diaphragm would contract, it would push on the abdominal cavity, increase intra-abdominal pressure, decrease intrathoracic pressure, and the lymphatic fluid would move in the lymphatic vessels from the abdominal region or abdominal cavity to the thoracic cavity, right? And then because these vessels lie next to arteries and veins, the movement of blood in those vessels may also help to kind of promote and propel and kind of push the lymphatic fluid along, right? We can progress from the vessels and we finally move into larger structures called trunks, right? And these trunks are draining lymphatic fluid from general areas, so from general regions, right? So jugular trunks, head and neck region, so think jugular like your jugular veins, right? So head and neck region. Subclavian is from the upper limb, breast area, superficial thoracic wall. Our bronchomediastinal trunks drain it from more deep thoracic structures. So broncho is referring to bronchi or lungs, and mediastinal is this space kind of in between our lungs, so kind of deep, think area near the lungs and near the heart. We have intestinal trunks from abdominal structures and lumbar trunks from lower limbs, pelvic region, things like that, right? And then these trunks are going to ultimately merge and form something called ducts, right? And there's two main ducts, right? There's one called the right lymphatic duct and one called the thoracic duct, right? Now, you should be familiar with these in the context of where they're draining lymphatic fluid, right? The right lymphatic duct is draining from the upper right quadrant of the body. So think like right side of the head, right arm, and right side of the thoracic region. And then the second one is called the thoracic duct, and it drains everything else, right? So it drains left side of the head and neck, left side of the thoracic cavity, left arm, and all of the abdomen and all of the lower limb, right? So here you can see kind of a indication of where you have your thoracic duct. Both of these, so thoracic duct and right lymphatic, they're both draining into the junction where you have your subclavian and jugular veins, right? The right lymphatic duct is draining on the right side, and the thoracic duct is draining on the left side, but they're both draining at that junction, right? So you can see that junction right here, right? So here's your internal jugular, here's your subclavian, there's your thoracic duct, here's your internal jugular on the right side, here's your subclavian, there's your right lymphatic duct, right? So those are good landmarks to look for, especially if you ever do gross dissection. If you can find those venous landmarks, then you may be able to find the thoracic duct and right lymphatic duct. Now, you can also trace the thoracic duct up because it starts as this kind of pouch-like structure called the cisterna chyli, right? And so this cisterna chyli here is kind of this mass, this kind of swollen region down here, and that's the area where this thoracic duct starts, that it's joined from lumbar and intestinal trunks, forms that cisterna chyli, and then it moves all the way up along the kind of near where the aorta is, along kind of this anterior border of our vertebral column, moves all the way up, and then again drains into that junction between the left internal jugular and left subclavian, right? So again, looking at an image like this helps you see the distribution in terms of the drainage. So again, purple is right lymphatic duct, so right side of the head, right side of the thorax, right upper limb, and thoracic duct is everything else. So left side of the head and neck, left side of the thorax, left upper limb, abdomen and pelvis, and then all of the lower limb, right? So again, if a exam question was talking about a particular region, so the left arm, the left hand, the pelvis, the right side of the head, what is that, or what vessel is giving the lymphatic drainage, right, or providing the lymphatic drainage? Is it the right lymphatic duct or is it the thoracic duct, right? Now, kind of last main thing here related to vessels and lymphatic fluid is this condition referred to as lymphedema, right? So edema is this accumulation of fluid in the interstitial space. And lymphedema is due to some type of interference or blockage of our lymphatic capillaries and vessels that's preventing fluid from entering the lymphatic capillaries and vessels, and then ultimately the trunks and ducts, and instead that fluid is accumulating in the interstitial space, right? So you see this localized swelling, and things that can cause blockages are things like trauma, infection, removal of lymph nodes, therapy because of cancer, so radiation therapy, scarring, things like that, right? So, after a mastectomy, the removal of a breast, there can be not only scarring but also removal of some of the lymph nodes as well, and this results in the potential for lymphedema. And oftentimes individuals who either have lymphedema or maybe they've had a mastectomy and they're at an increased risk for lymphedema, they'll wear compression garments. And so this, again, it puts more pressure on the surrounding tissue that helps to promote the return of that fluid ultimately back to the heart. There's also lymphatic massages as well that can help promote the movement of lymphatic fluid ultimately back to the heart, right? So this, all of this lymphatic fluid, right, and you can see it here, it's ultimately going back to the blood, right? So the lymphatic fluid ultimately came from the blood, and it's going back to the blood, right? So all of these different things, compression garments, exercise, massage, elevation of a limb, something like that, those are all an attempt to help promote the return of the fluid, right? There's also this condition called elephantiasis, and this is a massive accumulation of fluid, and this is typically secondary to a parasitic infection that blocks the flow of lymphatic fluid, right? So you can see both just general lymphedema and elephantiasis in this image. So this left image here is showing different stages of lymphedema. Sometimes you can have what's called pitting edema, in which you could push your finger on the affected region, and whenever you remove your finger, there would be a pit. There would be a depression where you push your finger because of this, all of this excess fluid, right? And then this image to the right, this is elephantiasis, right? So again, due to a parasitic infection that causes a blockage in the return of, or the movement of lymphatic fluid to the lymphatic vessels, right? So we will stop there, and we'll pick up in our next part, and we'll begin talking about and discussing different types of lymphatic tissues and structures based on what happens to the cells in those areas.